So, Doc, as you know, I mean, probably, I would say at least 30% of the patients that contact us now, either through the IAHRS, through the American Hair Loss Association, through the Bald Truth, bring up one of these automated devices that are being marketed either by, physicians or by the manufacturers, direct-to-consumer type of marketing. This is the issue. There's no doubt that in the right hands, a lot of these devices can really be practical and really work well. But it's being marketed as a procedure. This robotic device, the way that patients contact me, they actually think that the name of this device is actually a specific type of hair transplant procedure, as opposed to it just being a device that extracts grafts. I mean, I'm sure patients come into your office and actually, or call you and say, do you do this type of procedure? I mean, how do you respond to that?
Well, as we said earlier, most patients now are coming in and asking about follicular unit extraction.
Right.
So this is something I've actually been doing for years in my office. And I would venture to say I did my first FUE case in 2006 or 7. And I credit Dr. Alan Feller for that. When he was first getting into it, he had me out in his office, and he was fabulous, and he was showing me his punches, and I started doing it right after that.
Yeah.
Now, I will say a majority of my cases is still the strip procedure, but again, people are coming in, they're educated, and it's incumbent upon me to explain the pros and cons of strip versus FUE.
But let me interrupt you. Do they ask you, and I'll name the device, do they ask you for a specific, do you perform the NeoGraft procedure, or do you perform the IAHRS procedure?
Absolutely. Absolutely. So they're coming in armed, and basically my philosophy in this is, and I don't have one of those large, I don't have a NeoGraft, I don't have an IAHRS at this point. But I do have two different types of punches, and I'm from the philosophy is I like to have a couple things in my tool chest. So I do use the SAFE system from Dr. Harris in Colorado, and I actually have many of the punches that Dr. Cole has developed over the years. They're fabulous, very sharp punches. As you know,
right.
Harris's system is a dull punch. Cole is an advocate of the sharp punch.
Right.
Actually, I have Feller's punches, and not every patient who I do FUE on, the dull punch works well on. I'll have to go to the sharp punch, and not every patient who I tried on the sharp punch works that well, and then I try the dull, and I mix and match.
And I find that interesting that you're saying that, because there's a lot of doctors that, they're very dogmatic, and they'll say, it only works with a blunt punch, or it only works with a sharp punch. But I like the idea that you realize that, it's not, hair transplantation is not a one-size-fits-all procedure. Not everything is going to work for every patient. I mean, patients, skin types are different. The way that the hair splays underneath the skin, on the graft is different. And, so when you're dealing with a specific device and marketing it to the public and just saying, well, we do this type of procedure, I personally don't think that is necessarily in the patient's best interest.
Well, the problem with that whole thing is more people are finding out about these devices through some of the advertising I have seen. And the most prominent advertising I see is when I fly.
Yes.
I will see a patient, and I'm not going to name the device, that doesn't matter, but they'll show a picture of somebody who's had a strip procedure. Then next to it, they show a patient who's had an FUE procedure, and they show the strip procedure is this grotesque incision, and then they show the FUE is essentially unchanged. But the problem is patients should not look at that. They need to look at the results.
Well, and that's interesting that you say that, because that's one thing I'm thinking, well, they should actually have at least 4 pictures. Exactly. They should have the donor site, and they should also have the recipient.
Exactly.
And but the thing is, but that works. Listen, honestly, if I was marketing their product, I would do the exact same thing if I was not doing what I do. If I was not a consumer advocate, if I didn't believe in what I was doing, if I was just trying to sell their product, you can't blame them, because it works. It's compelling, and it strikes a chord, and it makes you think, wait a second, I could have hair transplant surgery without actually having surgery, because that's the way it's marketed in my view.
Coast to coast and worldwide. I just want to say, you guys are doing a great thing. It's such an uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.